was dealing with thyroid issues, hormone issues, lack of having even a menstrual cycle. But the biggest issue for me was chronic gut issues. And this led me to going the Western medicine route. I was having to be told that my entire large intestine needed to be removed because of the severity of a lot of my gut issues. The motility in my gut had completely come to a halt now at this point. I was put on 5+ medications. I was on birth control at the time. I was on anxiety medication. I was on prescription laxatives. And now I'm being told I need to have my entire large intestine removed, embarking on this incredible healing journey, which ultimately led me to healing my body 100% holistically. I was able to get off all medications. I was able to avoid having my entire large intestine removed.
I'm here with Rachel Scheer. Thank you for joining us. I'm going to sort of describe what you do, so I guess I'll give you an opportunity to do that once again if you don't mind.
Yeah, the second take will be better than the first, but the background, I am a certified functional medicine dietitian. I received my degree in Nutrition Science and Dietetics from Baylor University, and I help people with getting to the root cause of their chronic health issues. I take a holistic approach to healing. And my journey into this space actually began more in the fitness world. In bodybuilding, I competed in bodybuilding for 3 years back to back. Fitness was my first love. I was a gymnast. I was a dancer. Really, my core focus when it came to health was more on aesthetics and athletic performance. But 3 years into competing, I started to struggle with a lot of my own health issues. And a lot of them revolved around chronic gut issues. I was dealing with thyroid issues, hormone issues, lack of having even a menstrual cycle. But the biggest issue for me was chronic gut issues. And this led me to going the Western medicine route. I did probably every scan tests you can imagine through Western medicine, colonoscopy, endoscopy, CT scan. I was sent to every ologist that's out there. I was sent to the endocrinologist. I was sent to even the Mayo Clinic, who did more extensive testing. And it ended up being, I was having to be told that my entire large intestine needed to be removed because of the severity of a lot of my gut issues. The motility in my gut had completely come to a halt now at this point. And it was a very severe case of IBS. And that was really the answers that I was given. I was put on 5+ medications. I was on birth control at the time. I was on anxiety medication. I was on prescription laxatives. And now I'm being told I need to have my entire large intestine removed. And so for me, I was really faced at this point in my life with two decisions. One, to get the surgery, have my entire large intestine removed, which at the time was the route I was wanting and willing to take because I was so miserable in my own body and I was wanting a quick fix. So one thing that I do speak about quite a bit is I can so empathize and relate to people who are really struggling with their health and wanting that Band-Aid, wanting to take the medication. I'm never against any of that because I was there myself. But I decided that I was gonna try to heal holistically. I had that one little piece of hope inside me, and this just led to a whole nother journey of just becoming obsessed with learning everything that I could about gut health and the gut microbiome and how these microbes are connected to more than just digestion, but they play a role in our mental health. They play a role in our hormones. They play a role in our thyroid. And through this journey, I was able to discover a lot of the root causes were really stemming from a dysfunctional gut microbiome, which led me to healing my gut. When I say healing, it wasn't just only nutrition protocols. It was also having to heal myself holistically, because one thing I always say is the whole person must heal for the gut to function optimally. So I went through this entire really unraveling of my life and who I knew that it was, embarking on this incredible healing journey, which ultimately led me to healing my body 100% holistically. I was able to get off all medications. I was able to avoid having my entire large intestine removed. And this led to a new passion and purpose for me to want to help other people and get to the root cause of their health issues. I was frustrated with traditional Western medicine, and that's what got me into functional medicine. With my background in nutrition and dietetics, became certified through my own healing journey. I started to create my own coaching methodology and protocols. And now today, my practice has served over 5,000 people with taking a root cause approach. And it's incredible because it's evolved into what I now call a root cause revolution, and really just a pivotal shift in what we consider healthcare to be, because a lot of what really we have is sick care, not healthcare. So my whole approach and mission revolves around helping people heal holistically and not just survive, but really thrive in their life again.
It's awesome that you were able to get through that without having to have it collectively, because I see so many people with things like inflammatory bowel is not necessarily ideas that have found for bowel people with cause ulcerative colitis, admit that significant percent of these people will end up going on to some sort of resection, whether it's a plus fold, the whole resection. And I think probably most of them are avoidable if they make constantly fix their lifestyle, their nutrition, and so on and so forth. As a fitness competitor, a bodybuilder, again, I'm sure you're probably not eating a bunch of garbage. You probably had a pretty dialed in routine, and by probably most outward appearances, most people thought you're super healthy. What do you think was driving the pathology in your particular situation? I know with the amenorrhea, the loss of the menstrual cycle, a lot of women, they get early, and that's just what happens. We know that. That's a plague triad that we often see as part of that. But what do you think was going on in this case? What were you doing with the wall?
Yeah, and you're correct. My diet was pretty good, at least from a macronutrient standpoint. I ate whole food most of the time. However, there was things that were in my diet that probably wouldn't be considered gut friendly, because when you're competing in bodybuilding, you do try to rely quite a bit on artificial sweeteners and foods just to try to get any amount of flavor, because your food is just so bland. But in terms of what led to a lot of my health issues, I was under a massive amount of metabolic and physical stress. And most dis-ease that develops in the body really is a byproduct of some type of stress. This could be dietary stress that leads to chronic inflammation, leads to gut inflammation, leads to hormonal imbalances, leads to mental health issues. This could be because of metabolic physical stress like I was under, where I'm maintaining a very low percent body fat. I was around 10%. I was competing in back-to-back competitions for about 3 years. You could say I was overtraining based off of how much food I was intaking at the time in order to maintain 10% body fat. Your body is in a chronic catabolic state, which is a breakdown state. And bodybuilders, we try to avoid cortisol as much as possible because cortisol breaks down muscle tissue. We want to avoid that. So what do? We do a high protein diet to minimize as much loss as possible of skeletal muscle mass, but we also don't think about what happens to the gut, what happens to our neuroendocrine system as a byproduct when we're under physical stress that is chronic, when we're under metabolic stress that is chronic, and the gut completely shuts down. It stops producing digestive enzymes, and the motility comes to a halt. The thyroid slows down. The body slows down its hormone production. So testosterone, estrogen, progesterone for women all begin to slow down. That leads to amenorrhea. As the thyroid begins to slow down, which is a protective mechanism, motility also further slows down in the gastrointestinal tract. And that chronic high levels of cortisol, which is catabolic, it breaks things down when it's chronically elevated. It's actually anabolic when it's acute, like doing an ice bath or doing bouts of resistance training. But when it's chronically elevated, we don't think about the fact that the gut lining is also muscle tissue and it's only one cell layer thick. So what starts to happen is the gut is shut down, and now the gut lining begins to break down, leading to intestinal permeability, otherwise known as leaky gut. So we start to get bacteria, foods, and toxins leaking into the bloodstream, stimulating a immune and inflammatory response. So this is where a lot of people develop food sensitivities and they can't tolerate a whole lot of foods. Maybe they develop skin issues. And even in later stages, we can even see the onset of things like an autoimmune condition begin to develop. And with the gut completely shut down for a lot of the time and intestinal permeability beginning to develop, this also creates a drain in the gut where bacteria imbalances can begin to occur. So some people can actually pick up pathogens, especially because the immune system becomes suppressed when we're under that much metabolic and physical stress. This could also be emotional stress. Everything that I'm talking about, it's just stress and what the body does as a byproduct of chronic stress. So all of these things together creates a whirlwind where dis-ease begins to develop. We start to see gut issues, maybe bacteria begins to overgrow. I ended up having SIBO, so that's small intestinal bacteria overgrowth. This was leading to poor motility, constipation, chronic bloating, because the bacteria that began to overgrow were now fermenting on all the foods that I was eating. I had food sensitivities, hormone issues, of course, because that had declined, thyroid issues, because that had slowed down, getting sick a lot because the immune system had slowed down. And this is really how disease begins to occur, really for anybody. And my story, yes, may be unique to me, but it's not really unique. It's for anybody who is struggling with any kind of chronic stress, whether that's dietary stress, metabolic stress, environmental stress, emotional stress, physical stress. This is really the normal cascade of what begins to happen in the body.
It's interesting. I've seen a number of former physique athletes. It seems to me, and maybe just by my experience, but maybe that's not true, but it seems to disproportionately affect women in more. So, as you said, carrying 10% body fat as a female is equivalent to a guy walking around about 3%. They had 7-8% difference in essential fat requirements. And so that's extremely late. And I think what's maybe it's the standard for women is so much below what is physiologically even close to being normal that it may be disproportionately affects women. I see a lot of women coming from those particular sports that have lots of gut issues. It just seems to become that. Is that something you want to yourself, or is it
100%. Men definitely have more resilience when it comes to stress. And a big part of that is men don't have to worry about carrying a baby. Like, our bodies are built completely different. And women are not little men. That's actually not my quote. I've heard that quote before said by, I'm blanking on her name, but she's incredible when it comes to sports nutrition. But a lot of what's out there is treating women as if they're little men. But women and men are completely different when it comes to physiology. A woman has hormones that fluctuate throughout the month, versus a man's hormones really fluctuate throughout a 24-hour period. Men can handle more bouts of stress where women cannot. So this is where, too, with the fluctuation of female hormones, and especially when a female's body fat percentage gets below a point of where reproduction can really occur, the body is always trying to protect itself. So what it's going to do is it's going to essentially turn off the body's ability to procreate, because the body's saying we are not in a healthy enough place in order to have a baby. So everything always comes back to our ability to really procreate. So I remember even being a competitor at the time, like I was like, oh, great, no menstrual cycle. This is awesome. And it's a true sign of overall health, libido, sex drive. Do you have a healthy menstrual cycle? These are things that are incredibly important, but women definitely are more prone to a lot of these health issues due to their cycling nature of their hormones, due to their not dissimilar ability in terms of resilience. And then also women are more prone to develop autoimmune conditions. So women are more prone to develop IBS. And a lot of this comes back to the uniqueness in our physiology.
Do you think, I don't know if you still compete or anything like that, maybe, I know you're still fairly athletic. I saw some of your social media, you're still quite fit, and obviously you still like this sport, as do I. Do you think if you were to go back to competing again, could you do it in a different way so that you would not develop those same issues? You think it's physically possible?
To an extent, yes. I think anybody can if they want to compete in a healthy way. Now, to get to a point where you're going to be incredibly competitive and win, that's a bit of a different story. And I think for most people who step into bodybuilding and competing, it starts off as a very healthy venture. I know it did so for me. I found fitness, it changed my life. I felt confident for the first time in my life. And I was like, wow, I want to really see what I'm capable of. I want to do a fitness competition. And the double-edged sword was I won my first competition. And because I had my background in nutrition and dietetics, I never sought out a coach or an expert. I was like, hey, I know what I'm doing and it's working. I'm winning. So I just continued on with what I was already doing. And I got to the point where aesthetically, I was doing incredibly well when it came to these bodybuilding competitions, but that didn't mean that I was healthy. And that's where it ultimately led to a lot of my health issues down the road. And what's also interesting is not a single physician, when I went the Western medicine route, was able to really see what was happening. And that was what was so mind-blowing about my entire experience. I had done all these scans and tests and put on all these different medications to manage these symptoms, given a diagnosis of IBS, put on birth control. Okay, you have hypothyroidism. Here's synthetic T3 medication for you to get on. And if one person would have actually just taken a moment to get to know me, to look at Rachel, to look at my lifestyle, to say, hey, this girl's really lean, she's competing, and look at the overall picture and how all of this was connected, was, in my opinion, pretty obvious what was probably leading to a lot of these health issues. And that's where I really began to experience what was broken in our system. And I'm not against Western medicine by any means, because of course it's incredibly important when it comes to acute-based issues. But where I see people really struggle is with these chronic health issues when it comes to IBS, it comes to autoimmune conditions, it comes to depression, anxiety, that are really rooted in lifestyle. They are lifestyle diseases. So giving somebody a medication isn't going to fix something that is rooted so much in lifestyle.
Yeah, I mean, that certainly that's been my experience. Is a fraction of big service on this merits. Yeah. We do okay with acute trauma and cardiovascular up to probably living this whole. I guess, obviously you come from the dietetics background, you probably trained in the standard diet or the beginning, and you kind of push the USDA guide, basically, many ones. What are your thoughts on that?
Oh, yeah. I do not teach anything that I learned when I was studying nutrition and dietetics in university. So my philosophy is very different, because I remember even being in school and having a physician, it's all calories are equal. It doesn't matter in terms of like macronutrient intake. That's really the only thing that we need to pay attention to. And there wasn't really a whole lot of emphasis necessarily around even proper macronutrient intake. It was just based off of the RDA, and we know that the RDA recommendation of protein is the minimum amount that somebody needs in order to really not be in more of a very unhealthy state. It is by nowhere near as optimal. So there wasn't a whole lot of talk about that. And then not to mention, I can think back to a lot of the recommendations around like carbohydrates and grains and things like that, where that was a lot more basic and more general for the public. And I think if we look at a lot of what the RDA recommendations were compared to even what I see now in my functional medicine practice, there was a lot of recommendations around foods that aren't necessarily productive for overall, at least gut health, because that's what I focus on so much in my practice.
Do you see that, obviously, you've had success getting lean and maintaining muscle, eating a high protein diet? I'm sure a typical bodybuilding diet is basically chicken and brawn, but I think that's pretty much you did.
Yeah. I did filet and Chilean and sea bass a lot, though.
Okay. So, is there a better way to do that? I think potentially, I don't know.
So in terms of just basic vegetable, carbohydrate, and protein when it comes to bodybuilding?
Is there a better way to get ready for a fitness contest or figure contest or a bodybuilding contest without taking your hormones and showing your gut and that type of stuff.
Yeah, there's definitely better ways. As slow as possible is always going to be the best bet. So the slower we can go into any kind of weight loss is going to be beneficial because it's going to protect skeletal muscle mass. So what I see a lot in the bodybuilding world is a lot of these competitors will try to put on as much muscle mass as possible in the off season, which is really just a ticket to eat more of whatever they want. They usually put on muscle, but a good amount of adipose tissue to go along with it. And then they have to go into a 12-week cut where they usually go into very intensive training, hours and hours of cardio. I remember even looking at some competitors' workout regimens, and they were doing 2 hours of cardio a day combined with resistance training, eating 1,000 calories. And of course, they did lose weight, but it was at a very rapid rate of weight loss, which is going to put the body in a very stressed state versus if we can slow down that rate of weight loss. I never did that whole back and forth of bulking or cutting or any of that. Actually, as I came out of competing, it was a very slow weight gain that I went into where I put on 15 pounds, but it was over the course of honestly 5 years. And it was weight that I actually needed to put on. I also think too, a lot of competitors, they try to minimize fat intake as much as possible. And we really need adequate fat intake in order for our hormones to function the way that we want them to. So all of our hormones are made from cholesterol. So if we're not getting adequate cholesterol intake, if we're not also getting adequate fat intake, this is going to lead to hormonal imbalances, but also not to mention if we just get to a low enough percent body fat, of course, that's going to also lead to hormonal imbalances. Also, I'll say this, the 6 small meals, eating that throughout the day, a lot of bodybuilders will do this in order to try to protect their skeletal muscle mass as much as possible. It does work in essence in terms of providing the muscle with feeding windows throughout the day, especially when the body is operating more in this catabolic and breakdown state. There needs to be more of a distribution of protein throughout the day. Protein intake actually needs to be higher versus when we're trying to build muscle, because the body's actually going to burn a lot of these amino acids that it's intaking for fuel instead of just supporting that muscle mass. But we also see that when there is frequent eating throughout the day, the gut actually doesn't get as much time to rest and repair. So we have something called a migrating motor complex, which are cleaning waves that sweep bacteria throughout their gastrointestinal tract, and peak MMC action takes place about 3 to 4 hours in between meals. So for competitors or anybody who's really eating constantly throughout the day, they're disrupting their MMC action. So people who eat right when they wake up, and the old advice of small frequent meals boost your metabolism, that's been myth busted for sure. But all of these things combined between rapid weight loss, the body going in this catabolic state, constantly eating throughout the day with not adequate fasting periods, and then really lowering their fat intake. I think if we could modify those things at least a bit, maybe not eating 7 meals during the day, break it up to 4 meals throughout the day. If we could slow the rate of weight loss, and if we could keep fats maybe a little bit higher, I do think we could avoid some of the health issues. I'd say the other part of this would be not staying in the very low percent body fat range for an extended period of time. And that was really what I had to learn, because I was like, all right, great, I'm winning. I'm just going to keep competing back to back. And I never did any sort of a reverse or bringing my calories up or trying to get my body out of this low percentage that I was in. And that was a big mistake, because my body just inevitably was just operating in this very catabolic and breakdown stress state. So going in it and then knowing when it's time to come out of it is also pretty important.
So you were at a point, you said you were faced with the loss, the prospect of the, going on those on multiple medication, obviously not doing very well. What did you end up doing to turn that around?
Goodness, a lot of different things. First started with me just researching and learning a lot about the microbiome, which really wasn't talked about at the time. I think the conversation revolving around SIBO was relatively new. I actually went to a gastroenterologist. His name's Dr. Kenneth Brown, and he was on the front end research of SIBO. And he was really one of the first people to bring up SIBO to me. Even when I went to the Mayo Clinic and I went to these different gastroenterologists, no one was really actually talking about the microbiome besides the fact of, hey, maybe you should get on a probiotic. And the probiotic recommendation was pretty general. Get on the Align probiotic that they have at the CVS pharmacy. So I was like, oh, SIBO, this is interesting. I started to research and learn more about it. And I actually started to shift my diet around a bit. I had to do more gut healing diets. For me, a lot of the triggers were fiber, right? Which we think of fiber as it's great and it's healthy. And it is for promoting gut health. But when you have an imbalanced microbiome or you have bacterial overgrowth, fiber is a prebiotic fiber. So and then biotic bacteria. So it feeds bacteria that is in the gut. So if you're somebody who has a lot of overgrowth or a lot of inflammation, fiber is actually going to be adding more fuel to the fire of what's really happening there. So I had to go on actually a lower fiber diet. I had to remove a lot of fermentable carbohydrates, which helped a bit symptomatically, but it didn't really fix the problem. But for me, especially as I dove into more of the SIBO research and the microbiome, that was really a tell sign of there was something going on more so with my microbiome. So this led me down the route of doing stool testing, doing breath testing, which is really the type of tests that are needed for assessing the microbiome. Stool tests are great. They don't diagnose SIBO, but they can look for dysbiosis, imbalances in the microbiome. It can look for parasite overgrowth. It can look for fungal overgrowths. It can look for how well you're digesting and absorbing your food. It can look at intestinal permeability. Breath test really is the gold standard for assessing if there is any SIBO present, looking at hydrogen and methane levels that are in the breath. So, of course, I tested positive for all of these things. I had SIBO, I had the dysbiosis, I didn't have pathogens, thank goodness. I had intestinal permeability. I started to look more into functional medicine protocols revolving around addressing SIBO, dysbiosis, and healing the gut lining, which revolved around further dietary changes, a little bit more restriction, supplements to help regenerate my gut lining. At that time, I had to go through a killing phase of a lot of the bacteria that was overgrown. I did multiple rounds of antibiotics. I continued to relapse. I actually then had to go more of the herbal route. And now this journey is almost getting to be about a year long, but I am making progress. I am seeing improvement, but it'd be more like, okay, maybe symptoms aren't as bad, but they're still present. They're in my life. And it was really shortly after I started implementing a lot of these functional medicine changes, right? I'd done the testing now, I'm making the dietary changes, I'm using the functional medicine supplements, I'm doing the eradication protocols, and I'm seeing improvement, but continuing to relapse was when I started to take a much bigger look at my overall health and mindset. And this actually led me down the road of doing more of the inner healing work that I needed to do, because there was questions around why did I push my body to such extreme points, and having to make some pretty big changes in my life on really the relationship that I had with myself, my view of self, which so much of it at the time was actually stemming from my worth and my physical body. Bodybuilding is not a healthy sport by any means, but this actually led to a much deeper healing journey with myself, combined with a lot of the functional medicine efforts that I did. And it was the combination of all of these different things where I remember one day, I think I was like going out to eat at a restaurant and I didn't even think anything about gut issues. And I was like, oh, okay. I think they're gone. And then that continued on for a period of time. Not saying that I never had issues, but it was the combination of all of these different things that allowed my body to fully heal. And why I say the whole person also must heal for the gut to function optimally. We have to look at what really led to these problems in the first place. And traditionally speaking, we could say it was the gut and it was these imbalances and it was the metabolic stress. But what really led to that in the first place? And that's where we really come back to the self.
You mentioned leaky gut or gut permeability. Gut is selectively pumped. It wasn't stopped at that past the guts, in some guts. And there's different ways to assess that. There seems to be significant relationship between gut permeability and autoimmune disease based in war, because you'll see put on my children. How do you, I guess in your practice right now, I suspect that is something you look at. Or is that something you can assess? I know there's double sugar tests, there's thankful hunger testing. How are you assessing the gut, I guess, in general, with the blood patient? That's what you do.
Yeah, so we do stool testing at my practice, and we do breath testing as well. With looking for leaky gut specifically, we look for a marker in the stool. It's called fecal antizonulin. And this marker is typically higher when somebody has intestinal permeability, because zonulin is going to be the gatekeeper to those tight junctions in the gut.
And how often are you seeing that as part of the path? Is it pretty significant, automatically common?
I'd say more people have it than not. However, most people who are coming to me are coming because they have some kind of a health issue. But I think what's confusing for people is often people who don't have gut issues, maybe they have other health issues, right? They have allergies or they have sensitivities, skin issues, and they're like, what, my gut feels actually fine. And then they do come back with quote unquote gut issues or gut imbalances.
Yeah, I see that. That's, as you may know, I've been using carnivore diets to help people, and it's been seemingly very remarkable.
I'm a fan of the carnivore diet. Actually, for severe cases of autoimmune in my practice, we put quite a few people on the Lion's diet, which is even more restrictive, if you're familiar with that, than the Lion's diet. But it's worked incredible for autoimmune conditions, because most of the foods that these people are really struggling with is carbohydrates, and there are different lectins in the foods and different kind of immune triggers. So carnivore can be great. And then even for people who are more ill, like a client I had with rheumatoid arthritis and multiple autoimmune conditions and extreme flares, for her, getting on an all Lion's-based diet really helped a lot.
Yeah. When I wrote the book, I described that version as an autoimmune carnivore, which is obviously like 70% of our immune system resides in our gut. So it's obviously there's it's the largest interface with the outside. Where most people don't realize that the gut is external to our body. The inside of our intestines are external to the body, and that's our interface with the world. And it's our largest on surface area. Some people call it skin, but our skin is actually smaller surface area wise, and it's designed to keep things out after buff blood comes in. So it's got quite a huge impact. But what other, obviously, food impacts the gut? There's no doubt about it. There's a lot of other things, stress, whatever. There's a lot of things that can impact it. How long does it take? You're testing for antizonulin. How long do you see people turn that on? What is the typical time frame for people that to improve that and use serial tests?
Yeah, it varies for each person. The gut lining regenerates every 3 weeks, but I think what we're really looking at is the person actually removing the things from their lifestyle and diet that are leading to leaky gut in the first place, right? So it could be non-diet, right? It could be the stress that they have in their life. This could be, yes, food triggers, alcohol intake could be playing a role. Gluten and wheat can be a big trigger for a lot of people with intestinal permeability. So are they actually removing those things from their diet? And then are we giving the gut what it needs in order to heal and thrive? So often what I'll see is people will take a lot of the gut healing supplements. They'll get on the L-glutamine, the aloe vera, the licorice root, or the colostrum, which is great, but they don't actually continuously keep out the things that are needed for the gut to actually heal and regenerate. So we can get 4 months or 6 months down the road and we retest and we're like, okay, it's improved, but you still have a good amount of intestinal permeability. So we need to continue to work on it.
Yeah, that's not poisoning yourself. But no matter how much antidotes you take, if you keep poisoning yourself, I know that's an inflammatory term, but literally I think that's what's going on. But yeah, I mean, you mentioned wheat and gluten and probably I think sugars in some ways. And
yeah, sugar.
What are the big foods that are really common? You think are a little problematic, but that you probably shouldn't even things.
Yeah, wheat, gluten, sugar. You've already mentioned those ones. Alcohol. vegetable oils, seed oils, inflammatory fats, emulsifiers, which is more so a food additive. They found that those can be very disruptive to the microbiome. And then there's environmental factors too. So like cleaning agents we commonly use in our home, herbicides, pesticides, glyphosate, all of these things can disrupt the gut.
Yeah, it's interesting because when glyphosate was approved back in whatever the 70s or after the cortisol, it didn't really affect the underlying physiology, but what it does do is affect the gut microbiome. And so glyphosate, I know, is like things like grain products, things like fake greens, particularly the grain as it's used as a desiccation, right? The desiccation, all these ways that come in, all of it's that's something that was super get.
Yeah, I had it high on my tests.
Yeah.
When we run toxin panels on people, I always tell them it's not a question of really if you do, it's just more so how much. And really common ones I see, glyphosate, BPA is really common. Most people also have a little bit of mold, mycotoxins, usually the most common ones, which are more food-based mycotoxins, right? That can be found in rice or coffee. And then in more severe cases, we may see more home environmental-based molds that are a lot more problematic for people.
Yeah, you mentioned the BPA. So I assume, where you keep hearing about these microplastics through everybody, men's testicles and God knows what else, and so kind of coming everywhere. And how do we, I mean, is there a way, are there any effective ways to, because assuming we all are probably exposed to it on some point or another, but probably all of us have it. How do we, is there anything you can do to mitigate that, you think?
Yeah, I think it's a combination of two things. One, avoiding what we can. Like, we don't need to major in the micros, but the things you can control over, like one of the things I did, I switched all my Tupperware to glass Tupperware instead of plastic Tupperware. I stopped using a plastic cutting board and I went to using a wooden cutting board. I tried to minimize drinking out of plastic water bottles. I made sure I got a good water filtration system. I pay more attention to the kind of makeup that I use, my shampoos, the topical things that I'm putting on my body. So I made some changes, but I'm also not going to be the person who obsesses over it either too. We live in a toxic world, and I think sometimes we can just get overly hyper-focused. But yeah, should we try to be more cognizant in making some of these changes to promote overall health? I'd say yes. And then the second part of this is really just supporting your body's own detoxification processes. So making sure you're getting adequate antioxidants. A lot of people have methylation issues. We see that quite a bit in our practice. So supporting methylation through making sure you're getting adequate B vitamin, folate intake, making sure your glutathione levels are optimized, making sure your gut health is in a good place, because your gut is also important for detoxification. So supporting our body's natural detoxification, I think making some of these changes can actually go a pretty long way for people. And especially we've seen it time and time again in our practice. Someone will come in and their toxic load is pretty high. We'll support detoxification. We'll do a little bit of an environmental clean out. And actually their levels go down exponentially. I'm actually very impressed to see the amount of improvement we see when we retest.
Yeah, interesting. You talked about functional medicine, which I guess maybe, what does that mean to you? What does functional medicine mean? Because maybe I'm ambiguous or something.
It means root cause approach. Essentially, there's a lot of different functional medicine practitioners, which physicians can be functional medicine practitioners, dietitians, but whether you're actually practicing medicine would need to go back to what your base education and license is truly. And so we're more in, I guess you could say, functional medicine nutrition. We are partnered with a medical care team where we can offer medicine and hormone replacement therapy and all of that. But my coaches and myself, we primarily use food as medicine. We do more of the functional medicine diagnostic type testing, although we don't diagnose. We utilize that testing and then we create the protocols using functional supplements, food, lifestyle changes, and then if needed, refer to the medical care team. You can do some other more medicine-based options.
You mentioned bodybuilding, anti-catabolic effects of eating freaking protein meals, which is, it's true. I mean, that's what we do. Mm-hmm. What are your thoughts on protein these days from the lens of just a healthy person and not a fitness bodybuilder competitor? I mean, are we still under eating protein as a society? Are we overvaluing it? What are your thoughts?
I think the conversation is definitely changing. I can give a lot of thanks to my good friend, Dr. Gabrielle Lyon, who does muscle-centric medicine. She's one of my best friends, and she's done an incredible job with just shifting the conversation revolving around protein. So people are more aware, but I'd say still on average, most people, not looking at bodybuilding, but just overall health, are massively under eating their protein intake. Most people aren't really focused around resistance training. They're not focused around skeletal muscle mass. I love her conversation about how the problem is not that we are overfat, it's that we're under muscled, and excess adipose tissue is really a symptom of the root problem, which most people are not focusing on skeletal muscle mass. My recommendation in my practice is at least 1 gram per pound of ideal body weight in terms of protein intake.
Yeah, and I know grandpa come.
Yeah.
Like this stuff. Do you find that that recommendation changes with age, activity, sex? Is there any caveats to that?
Yeah, as we get older, protein intake also needs to increase because we actually become more catabolic. The rate of muscle protein synthesis also decreases. What we often see is older men or women who get into their menopausal years, they actually eat less protein when what they really need is the opposite. So even increasing beyond up to 1.3 grams per pound of ideal body mass would be more ideal for women in their menopausal range, or guys even at the equivalent age too.
Yeah, that's where I'm at. I'm almost 60. I eat a lot of protein, I'll train, and I want to also I haven't gotten angry, so that's it. That's a good sign to help in that aspect. I guess you mentioned CarnivoreDiet. Red meat, obviously, when you were in dietetics school, dietitian school, you would have nothing much, the saturated fat's going to kill you. What are your thoughts around that sort of sentiment?
In terms of in dietetics, where it was just avoid saturated fat and like the demonization of saturated fat and cholesterol and that being the problem. Yeah, I disagree with that. And that was definitely what we were taught a lot in dietetics. I actually tend to have my cholesterol a little bit on the high end. And I think cholesterol, saturated fat, it's not the problem. And I'm sure you know this, but being an advocate for the carnivore-based diet, but really the problem is insulin resistance. It's metabolic syndrome. So it's chronic inflammation paired with insulin resistance paired with, sometimes hyperlipidemia and cholesterol. That's really setting somebody up for a lot of downstream negative health issues, cardiovascular risk factors. But cholesterol in of itself, when elevated, is not a problem. Now people can do more extensive lipid panels, especially if there maybe is a little bit of a genetic predisposition. But I find that the conversation around cholesterol and demonizing it and also minimizing cholesterol from people's diet who have really high levels, and especially if they're dealing with insulin resistance, really isn't still fixing the root of the problem.
Yeah, one of the interesting things that most people don't realize about saturated fat intake in this country, only about 3% of saturated fat we consume in this country comes from things like meat, whole meat, everything else. Most of our saturated fat comes from desserts and prepackaged meals and pizzas and things like that. So that's where most of it comes from. So it's not like, is it the saturated fat or is it how it's packaged? And I think probably more than one. So as far as use, what kind of conditions? I mean, obviously you've got a lot of conditions. What have you seen downstream to fixing the gut? You mentioned on the arthritis. What type of things? I mean, is it more health? What are the types of things that are gut health?
Yeah, autoimmune conditions, like you mentioned, rheumatoid arthritis is a huge one. So people who have autoimmune issues with their thyroid. Mental health is also really huge. Most of our neurotransmitters are produced from the gastrointestinal tract. However, I will say this, when people quote online that 90% of our serotonin is produced in the gut, they also don't realize that most of those don't cross through the blood-brain barrier, but there is an impact on the vagus nerve, and neurons that fire together actually fire other neurons around it. There is a strong association between dysbiosis, leaky gut, mental health issues, anxiety, depression. Nervous system regulation is also incredibly important for somebody who's struggling a lot with the nervous system. We want to, of course, work on the brain. We want to work even on a lot of the root causes, which can often be rooted in trauma or chronic stress, but we also want to tackle it from the gut side as well, too. We want to make sure the gut is nice and strong and healthy, which means that we have a good diversity of different types of bacteria in the gut, types of overgrowths that are in there, that the gut lining is nice and strong and healthy, that the immune system is in a good place in the gut. So definitely mental health is huge. They've even shown that poor diversity in the gut, poor gut health is also rooted in neurological disease too. So it's one of the best things that we can do for preventative health when it comes to things like Alzheimer's, dementia, along with, of course, a lot of the other lifestyle things that we'd focus on: adequate omega fatty acid intake, overall lifestyle, supporting skeletal muscle mass is also incredibly important. I'd also say overall skin health is also a big one we see a lot. So people come to us with acne, psoriasis at the core can still be an autoimmune condition, but we have our gut-skin connection. So we have our skin microbiome that plays a role. And just like you alluded to earlier, right, the gut is not actually inside the body. It's a hollow tube. And if you think about it, actually connects quite a bit with our skin outside our body. So when our gut is healthy, that plays a massive role in our skin. It plays a huge role in our immune system. We can also go into allergies, sensitivities. So people who have a lot of environmental or food allergies, working on the gut and the immune system there can also improve a lot of those.
Do you see, I'm sure the answer, I'm sure there's one diet fits all sizes type of thing. Do you see any trends? Like I've seen in my experience, I see people that have central nervous system issues, those fat becomes more important as a macronutrient. Do you see any kind of distinguishing feature for this disease? Probably responds better to this type of protocol versus another disease as well, kind of the same thing.
No, there's definitely different diets that can be associated with different diseases. For example, autoimmune conditions we see work very well on carnivore, lines-based diets. And if they can follow that for a period of time and do a good job healing their gut, because that's really what's happening is the gut is getting a chance to rest and heal, transitioning to more of an autoimmune protocol, which is more so just removing common triggers like nightshades, things like that, that are found in common carbohydrates in somebody's diet. For someone who's maybe struggling with neurological issues, the ketogenic diet, has been shown to be incredibly beneficial. We know people with epilepsy, the ketogenic diet has done wonders for. So a lower carbohydrate diet, higher fat intake. So there definitely are more specificities that can come to specific diseases in terms of macronutrient intake and the types of food that one is eating.
Rachel, we're about out of time. Unfortunately, it's been a pleasure talking to you. Can you share, like, this, where people find you if they want to maybe, I know I assume you're probably online and you set nationwide, or where do people find you if they want to your session maybe?
Yeah, I'm the most active on Instagram. You can follow me at Rachel Scheer. My practice is at Rachel Scheer Nutrition on Instagram. And my website is rachelscheer.com if you want to learn more about my practice and everything that we do.
Awesome.
Thank you, Shawn.